Hi, I'm Mohammed Rehman, one of the MSN FNP students at Franklin University. I'm going to present one of the very important diseases happening around this season, that is influenza. I'm going to talk about this disease in details, about the causative organism, sign symptoms, its prevention technique, and importance of vaccination as a preventive measures. Influenza is an infectious disease commonly known as flu in public. Seasonal outbreaks of influenza occurs annually worldwide, leading to deaths of tens of thousands of people. Additionally, severe outbreaks of pandemic influenza throughout the history have caused deaths of millions. Flu is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and lungs. There are two main types of influenza viruses that can cause epidemics. One is type A, another is type B. These viruses that routinely spread in people, that is, the influenza viruses, are responsible for seasonal flu epidemics each year. About 8% of US population gets sick from flu each season. Most experts believe that flu virus is spread mainly by tiny droplets made when people with flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby. Less often, a person might get flu by touching a surface or objects that has flu virus on it and then touching their own mouth, nose, or possibly their eyes. The influenza viruses are being spread by migrated bird and transported domestic poultry like chicken, ducks, even through pet birds, and then transmitted to humans and some other mammals like pigs. Influenza viruses spread from one person to another primarily through the large particle respiratory droplets transmission. In other words, when an infected person coughs, sneezes, or even talks near a susceptible person, virus can exit the infected person and enter a new host. Transmission generally requires a close contact between the source and the recipient person because the droplets cannot remain suspended in the air for too long and generally travels only a very short distance of 6 feet. Contact with contaminated surfaces is another possible source of transmission, as the virus can live on non-porous hard surfaces for up to 48 hours and on clothing for up to 12 hours. The principal presentation, the pictorial presentation above states that the influenza infection is largely limited to the upper respiratory tract and can produce a myriad of symptoms including rhinitis, pharyngitis, bronchitis, and even pneumonia. Generalized body aches and pains associated with influenza are what that sets it apart from other infectious respiratory illness. The typical incubation period for influenza is between 1 to 4 days from the time of exposure, on average 2 days. The onset of influenza is typically abrupt. Symptoms typically include fever, muscle pains known as myalgias, generalized body aches, hard headache, sore throat, also known as pharyngitis, stuffy nose, known as rhinorrhea, and cough. Patients may also feel fatigue. The acute illness typically lasts between 5 and 7 days, at which point the patient typically starts to improve, although the fatigue and cough may linger for several weeks afterwards. Adults shed influenza virus from approximately 1 day before symptoms begin through 5 to 10 days after the illness onset. Most people who gets flu usually recover within 2 weeks. unless any complication develops, such as pneumonia. In some of the patients, this complication may be life-threatening and result in death. Sinus and ear infections are very common examples of common complication from flu, while pneumonia is a serious complication caused by flu. And this complication may result either from flu virus itself or sometimes by concomitant infection caused by other bacteria. As mentioned previously, influenza virus infection is associated with significant post-influenza diseases and even death, particularly related to severe respiratory complications such as pneumonia. Onset of complications could occur after influenza infection and can even progress to lung failure within 24 hours. The most common bacterial etiologies are Streptococcus pneumoniae and Staphylococcus aureus, including MRSA. And Haemophilus influenzae are the most common pathogens, as well as some other gram-negative bacteria and other healthcare-associated bacteria are also involved. One fatal condition known as Ray's syndrome, which is not so common, but it may result in fatal condition because it is commonly seen in children and teenagers who has had a history of any viral illnesses, most commonly influenza or varicella. And this illness is characterized by fever and rash in the prodromal phase, followed by swelling of the liver and brain. That leads to encephalopathy, and it is usually caused because during their course of disease, if they are treated with aspirin. A number of tests can help in the diagnosis of influenza. Most commonly used tests are rapid antigen test, direct fluorescence antibody test, and PCR. Early treatment usually include treatment with known as Tamiflu, that its medical name is oseltamivir, or zanamivir, known as Relenza, is recommended. An antiviral treatment usually most effective if it is started within 48 hours of onset of symptoms. And for the prevention, the most effective method is vaccination. So every person, usually beginning of the flu season, must be take influenza vaccine, and it is quite safe for any person, even in children over 6 months old. Traditionally, influenza virus is spread from one person to another, primarily through the large particle droplet transmission, like coughing or sneezing. Transmission via a large particle like droplets and require close to contact with the source. So we should cover the face and nose while we do the sneezing, and the person nearby should always use the mask. And thank you all for listening this video with patience. Thank you.